Hello, I am Dr. Warren, that is Warren. This video will act as my dissertation to receive my PhD in behavioral psychology and counseling, emphasis in abuse counseling. In this video, I will record a session with a client in hopes of exercising proper patient protocol, as well as, I guess, detailing the diagnostic procedure throughout. I hope you enjoy, and come with me to my office. Hello, Ophelia. It is a pleasure to finally meet you. I will be your doctor, Dr. Warren. Yes, that's Warren. Hello, doctor. So by the looks here of my sheet, it looks like this is your first time here at Rosencrantz Psychiatric Hospital. Can I ask you just a couple baseline questions, employment, marital status, Sure, go ahead. I can answer anything you want. With that out of the way, may I ask about the incident at hand? It says here that you approached with an issue about a conflict that escalated between you and a character of interest? Yes. His name is Hamlet, my lover. It says here that there were multiple people involved. Polonius, that wretched queen. Anyone willing to exploit me, really. I see. Do you think you could tell me a little bit about the altercation in question? Well, my father tried to keep me away from the one man who I thought was worth loving. And that same man tried to make me out as a harlot in front of the entire theater. Don't get me started on Gertrude. Oh no, please get started. I don't know. I just think it speaks volumes about the kind of woman you are to climb into bed with your late husband's brother. Maybe it's just me, though. Thank you, Jennifer. As you can see, in the beginning of our sessions, we like to try to get an understanding of the patient's background, their current standing, employment, job status, marital, anything like that. It's usually around this point where we try to begin the psychological evaluation. Usually we will begin to look for things such as inconsistencies with mood, maybe any signs of potential domestic or interpersonal turmoil, anything basically that points to relational dysfunction. At this point, we begin to probe deeper and see if we can figure out what's wrong. Tell me about your childhood. Nothing much to talk about. Spent about 10 years with my mother before that bucket was kicked. Uh-huh. Now, how does that make you feel? How about not the greatest? My father was never the huggy type, but once my mother was out of the picture, it was nothing but ice. He tried to play mommy and daddy, stay good for me and my brother. Even when he got elevated to royal lapdog, he still kept up that faithful guardian act, but it did absolutely nothing. Now why is that? Well, Doc, when you spend your whole life being the dumb one, or the pretty one, or the naive one, it starts to wear on you. Didn't even notice either. Just thought I was moody. But what kind of person just lays in the castle grounds and sobs for hours for no reason? Can I make a conjecture? Oh, no, not at all. Please, correct me if I'm wrong, but I'm getting the sense that your father wasn't much the type to raise your confidence. Maybe quicker to discourage you than encourage. Absolutely. Couldn't say a nice thing if he tried. Got so good at it that even my brother started joining in. Oh? Tell me about Laertes. I have nothing but love for that boy. What my father couldn't do, Laertes could. And what Laertes couldn't, no one could. He would do anything for me. And I'm grateful, don't get me wrong. But, big brother syndrome. I understand. Now, did you tell him how it made you feel? Why should I? Just his stupid kid sister being sensitive anyway. Hey! Your feelings aren't any less important than his. But something tells me you know that, Ophelia. So why don't you really tell me why you're afraid to tell him how you feel? I don't know. I feel like I owe him, He does so much for me, and how dare I repay him with groans about him hurting my petty childish feelings. I see. We now begin in this part the multi-axial diagnostic assessment. Ophelia has begun to show signs of passivity, lack of self-worth, and codependency. Given her home life, I believe that we can confidently surmise that she lacks an intrinsic sense of motivation. If we're looking at it, her sense of ambition was stifled by her father's constant put-downs, and her brother's insistence on caring for her has reinforced her dependent behaviors. When we look around, we see the roots of potentially a personality or an affectation disorder, but more information will be needed before. Do you think you could go a little bit more in depth about the flower episode? It was quite the day, Doctor. I remember the looks on their faces. Those clowns looked like they saw a ghost, seeing me strut in, hair about my ears, flowers in hand. I said what I did. One by one I handed them their flowers and I sang. Felt good to get that off my chest, and it felt even better to shock them to their shoes. Were these feelings being bottled up for a while? Meh, you could say. I was riding a wave of sorts, following the wake of my father's death. I was sad, but it wasn't a blue sad. It was like a red sad, a pink or a purple sad, a giggly sad, if you will. Could you describe what was following your encounter with Gertrude on that fateful night? I had been meaning to talk to her for a while, just never got around to it. I went flower picking in the garden that day, just thinking about Daddy and everything. Then the voices in my head called me complacent, and I hate that word, Doctor. Hate it. So, threw on a tunic. I grabbed some rue and long purples, barged into the royal quarters, and I spoke my mind. Did you say voices? Elaborate. Yeah. You don't have your own little brain, people? They used to scare me. But they're kind of comforting now. They sound like my mother. And how long would you say these voices have persisted? They come like a period, Doc. In and out. Always inconsistent. Never convenient. Quite honestly, I don't think I've ever said it out loud until now. Further inquiry revealed that Ophelia had experienced extreme mood swings, extensive periods of lethargy, as well as decreased appetite and social withdrawal. She was also cited to have experienced grandiose delusions, pressured speech, and impulsivity. I have two differential diagnoses for Ophelia. The first being schizoaffective disorder, which was ruled out because she did not display pervasive patterns of psychosis and only intermittently experienced delusional bouts. The second being bipolar disorder with psychotic features, which was ruled in. The client appears to possess characteristic hypomanic episodes, followed by depressive lows. The addition of her auditory hallucinations changed the nature of the diagnosis, but was distinguished by its transient and temporary nature. Given our understanding of the client, we understand that these symptoms can be attributed to chemical imbalances within the brain. Overactive dopamine and norepinephrine receptors, as well as a pronounced deficiency of serotonin, could point to the degree of her mania as well as her lack of self-control. I will be prescribing my patient 10 milligrams of olanzapine to be taken every evening before bed, as well as weekly sessions with myself, Dr. Warren, and our resident therapy dog, Yorick. Oh, he just peed on a patient. He's so funny. As you can see, I properly diagnosed the client while performing proper patient procedure. Hopefully it is up to you whether or not you believe I deserve my PhD. Thank you for listening to my video essay. I am Dr. Warren, spelled W-A-R-R-E-N. Hope you enjoyed, and I will see you next time when I diagnose Hamlet with BPD.